What's going on? What's going on? Happy Easter and welcome to World Kidney News Special Report. I am your host, Steve Belcher. Thank you for joining. This is going to be a great show tonight. It's going to be about a half an hour, and we're going to be talking with Dawn Edwards. She's going to update us on the ESRD Network 2 COVID-19 task force up in New York City that deals with kidney warriors. Before we get to Dawn, I'd like to thank our partners. Where is that? Oh, here we go. I'd like to thank our partners at Kibo, the makers of Renadil. Before I discuss about this product, these statements have not been evaluated by the U.S. Food and Drug Administration. These products are not intended to diagnose, treat, cure, or to prevent any diseases. Now, this product right here, this baby right here, Renadil, if you suffer from kidney problems or low kidney function or renal deficiency, this product right here, Renadil, it does something called intestinal dialysis. It uses probiotics and prebiotics in the gastrointestinal system to support healthy kidney function. And if you go to their site, we have it on the ticker. Kibo has a special. If you go to the website and register, you can get 3 bottles for $141. It takes about 3 months for this product to actually see some results. You use the code Urban Kidney 2020. Also, I'd like to thank our partner, Dialysis Kidney Warrior. Dialysis Warrior Gear, the maker of the mask. If you need any mask, you can reach out to Dialysis Warrior Gear. And let me find Mike's information. If you're interested, there you go. It's screening across the ticker. Dialysis Warrior Gear. He also has another brand right there. So if you're interested in any mask, reach out to Dialysis Warrior Gear. We have his information on the ticker. One last thank I want to give to is the AAKP, their initiative, High Potassium Awareness Day, May 1st. And let me put their information out there as well. Here we go. Are you okay? 0K. You got to watch your potassium, especially if you're a kidney warrior and you're trapped indoors, okay? Or if you're not going out, you got to watch that potassium intake. And I encourage you to go to their website and register for the webinar, the National High Potassium Awareness Day, May 1st. Share this broadcast. Now, let me give you some bad news right quick and good news. The bad news is we'd like to send thoughts and prayer to the family of kidney warrior Gabriel Torres. He was on our show, Sunday Morning Transplant Coffee Talk, about a year ago. Well, no, I'm sorry, back in August. And he needed a lung transplant. He was a fighter since he was born. And he lost the struggle, or it was just too much for his body. and he passed away yesterday from Dayton, Nevada. And our thoughts and prayers are with the Torres family. Now, good news. I just got word that kidney warrior Daryl Queen out of Baltimore, Maryland, I personally know him and was a nurse, his charge nurse, is at UMMS as we speak, being registered for a kidney transplant. He got the call on Easter Sunday in the midst of a pandemic. He got the call. God is good. So without further ado, let's bring on our guest. She's no stranger. She's contributing educator to Urban Health Outreach Media and World Kidney News, 29-year kidney warrior and home dialysis expert, no other than Don P. MORMAN Edwards. What's going on, Don?
Hey, how you doing? Happy Easter, everyone. Happy Easter, Steve.
Happy Easter to you, Don. Thanks for
Thank you.
on the show and giving us an update on the ESRD Network 2 COVID-19 Task Force, New York State.
Sure, it's my pleasure. There's a lot going on up
So,
here in New York.
excuse me. First of all, how are you doing?
Thank God I'm doing well. I'm staying indoors. I'm doing my hand hygiene and I'm keeping clean and wiping off doorknobs and doing all of the things that we've been instructed to do and keeping up with my treatments and watching my diet.
Well,
And
let me
thank
ask you
goodness
this.
everyone's doing well.
Let me just ask you this. Do you
Sure.
live by yourself?
No, I live on the top level with my mother. My mother's in the room right next to me, and then my daughter and her husband live downstairs.
Okay, so that's why you wiping off doorknobs, because I was going to ask you
Yeah.
if you were just by yourself, you wouldn't be going through that extra measure of
No,
wiping off the doorknobs and stuff like that.
no, because it wouldn't be and nobody coming in and out of here. But you just can't be too sure. My son-in-law works in the corrections field, and my daughter
Mm.
works for a hospital. So
So, uh, are there any cases where your son-in-law works?
no, thankfully he works for the institution for the criminally insane. And so they have his whole facility locked down, no visitors, no anything. And thank God they haven't had any cases as of yet. And he said they're being extremely vigilant. So thank goodness they haven't had any cases. My daughter, she works for a hospital, but the she works in the wound care clinic, and that clinic is closed right now. So she
Mm.
hasn't been out too much. She just goes out, once in a while. So, but you still can't be too safe. And they don't come up and visit too often either. We yell up and down the stairs and talk on the phone.
Right, right. Or do you have a kitchenette upstairs or something?
We have they have a kitchen downstairs and we have one upstairs.
Hmm.
So
Now,
we don't
Don,
share.
right now, let me ask you: you're in Brooklyn?
I'm in Queens.
Oh, you're in Queens.
Hmm.
Now, have you been out any time within the 2 weeks to go
Yeah.
anywhere?
Yes, I have. I had to go out. Unfortunately, I had to go out to the drugstore to pick up my medication. I have one of my medications that can't be delivered because it's a controlled substance, and you have to pick that up yourself. So I had to go out. So I geared up and wrapped up and everything, and went out to Walgreens. Thank goodness it's a 24-hour Walgreens. So I went 10 o'clock at night and they had it's a line of people standing outside and they're only letting about 10 people in at one time, and they're making everybody stand 6 feet apart, and you just you got to go do what you got to do.
Well, let me ask you this before we get with the task force. Um, is it like we hear on the news, like people standing out in lines and at the hospitals and uh,
Yes.
body bags and the trucks.
Yes, it's exactly like you see on the news. The trucks are outside the hospital, the refrigerated trucks. They're outside the hospital. They have tents outside where they're doing the testing and the triaging. And it's just like what you see on the news. It looks like
Wait
a
a minute. Well,
war
let me
zone.
ask you this: have have you been for testing?
Absolutely not.
Now, why are all these people going for testing? I mean, have they been
Be-
exposed to something? I mean, if they're not displaying any symptoms or anything like that, why would they be in line going for testing?
Well, you have to
And
make
you're
an
not in
appointment.
line for testing.
No, you have to make an appointment first in order to even go to be tested. So, what they're doing is they're calling people in, and because they're symptomatic, and so all these people on these lines and stuff, they're symptomatic, and they have to
Really?
wait online for the tests. Yeah, there's
Wow.
thousands of people. You know, like
But could
we've
those,
seen the news
but
report.
let me ask you this. Could could there be a possibility out of all those people that could be symptomatic that could be contributed to other symptom I mean other
Oh,
problems and not be
absolutely.
COVID-19?
Oh yeah, everybody doesn't have it. Some people have certain symptoms. And I mean, these symptoms are indicative of, just about any kind of viral infection. You can have a cough, you can have a runny nose, you can have a fever, and
What
it
so
doesn't
what
have to be
about could it
COVID.
be right, but could it be indicative of also of seasonal allergies?
Sure, some people have allergies. And,
Mm-hmm.
those are the people, that don't require emergent care. But there are some people that in need of emergent care, because most people, they're sending them home, and they're just telling them to quarantine for 14 days and to come back if their symptoms get worse. So
Mm-hmm.
they don't have room in the hospital for everybody.
Mm-hmm.
We
Well,
we recently had a news article that came out up here, that said that a notice to the EMTs, if they pick up anyone in cardiac arrest and they can't revive them in the ambulance, to just call the police department. Don't bring them to the emergency room because they can't help them.
hmm, wow.
So
I
it's
like
that
to take a quick
serious.
right. I like to take a quick pause to thank our YouTube watchers that may be watching from YouTube. God bless you and happy Easter. Don, do you think there's a lot of fear mongering going on?
A lot of what?
Fear mongering.
Oh yeah. I mean, we're in a panic. I think everybody is paranoid, and rightfully so. For those of us who are immune compromised and those of us who are vulnerable, it's really affecting the underserved communities. It's running wild in the hood. Our Brooklyn residents, it's the highest count is in the Bronx right now, and these are the underserved areas with with the highest African American, Black, and Brown population, and these are the people with underlying health issues, and
Hmm.
so there's a reason to be concerned.
But let
But
me ask you
mhm.
this. You said it's running rapid in the hood.
Yeah,
Now, why? This is show is we're going to get to the task force, and we're not going to get off skew, but just a question, as Arsenio Hall used to say, to make you go,
mm,
Um, why is COVID-19 that quote originated or came from China? Um, how could it be so spread it among disadvantaged minorities at such a horrific rate in the United States, but when you look at China or these other countries, it almost seemed like it's across the board. I mean, I know you're not a scientist or
Right, right, right.
epidemiologist, but in your heart of hearts, what makes you think, or how, not what makes you think, but how could something like that be delivered into minority communities? It almost sound like back in the 80s when they dropped a shipment of cocaine in the urban community and
Mm,
guns. Uh,
I
it
I get
just
you.
disseminated the community. But how could a virus like this be hitting minorities at such a disparate rate?
Well, I see it as the same thing that happened in China. New York is a heavily populated area. Everybody's squished into everywhere. When you think about public transportation, our schools, our stores, everything is busy, the hustle and bustle here in New York, and everybody's all in one place at the same time. So, just like the people in the upper scale neighborhoods, they're getting it, but we all ride the same train, or we all are in the same taxi cabs, or at the same Starbucks, or and things like that. So I would imagine that it would spread just like any other virus amongst people. The problem is that the people in the underserved community have those underlying health issues, and
Yeah,
that's what's making
Candy
it deadly for
Mulligan
us.
mentioned that right here. Yeah,
Mm,
underlining
right.
issues,
It's the underlying health issues, the diabetes, the hypertension, the lupus, the sickle
the
cell,
asthma.
those exactly, things like that. Those are the things that send us to the hospital, whereas people who are healthier can just go home, quarantine for 14 days and get over it. Meanwhile, we with the underlying health issues end up in the hospital and unfortunately end up passing away.
Sure, sure. Now let's talk about the New York State ERSD network too. I know it cover a lot more than New York State, I believe, or it's just New York
Right.
State it covers.
No, it's the my network 2 just covers the entire New York state.
Okay,
Some
yeah,
networks cover multiple states, but there's a network for every dialysis center
sure,
in
sure. I think it's
the
about
United
like
States.
18 networks.
Right, there's 18 altogether, but they
Okay,
encompass the whole United States and its territories.
sure. Now the the ESRD network 2 COVID-19 task force. What's going on? What's the latest? Because I know when you was on about 2 weeks ago, you was mentioning that a lot was going on in dialysis units up in New York. You had people quitting from dialysis. You had
Yeah,
we got people sitting in cars waiting for their loved ones while they're in treatment. We had
right,
patients infected with the virus. You were talking about people possibly being moved to other facilities as a COVID-19 facility. So, since 2 weeks, what kind of update on the COVID-19 situation that's happening in New York concerning kidney wars you got for us?
well, just like I started 2 weeks ago, and I gave you, a little bit of information about things that were going on in New York about them moving some dialysis patients. All patients were required to come into to facilities alone. Everyone had to be masked. They've put all of those plans. They've just amped them up, and they've mobilized everything now. Now they have official COVID-19 dialysis units. So a lot of patients have been moved from their um, if they've been diagnosed or if they're symptomatic and under investigation, they have been moved to the COVID-19 facilities in their borough. Um, we have reports of patients having difficulty with transportation because the ambulance drivers and the transportation workers don't want to transport a COVID-19 patient to and from dialysis. So that's one of the biggest issues. The last time I spoke to you all and I reported, I believe I said that there was about 198 or 203 patients in New York State that had tested positive. And as of last week, Thursday, let me see, let me get my paper here. As of last week, Thursday, when we had our last meeting, there's a total of 491 COVID positive patients tested positive in the entire New York State, and that's from 113 dialysis facilities that we have in New York State. And so we have 491 of them tested positive, with 250 of those patients had been hospitalized, with 183 of those patients positive that are receiving in-center dialysis treatment. And 8 home patients also have tested positive. And we had, as of last week, Thursday, 70 patients uh, confirmed that have passed away. And that's our results as of last week, Thursday. Now, this week, Thursday, we'll meet again and we'll get a new set of figures. And just like everything else, like the reports that we've been getting on the news daily, those numbers are expected to increase.
So you had 8 warriors that passed away from the COVID-19.
No, we had a total of 70.
70
That's
people that
70.
passed
That's
away?
seven. Yes,
70
70
patients passed away from the COVID-19 in the whole state of New York.
confirmed. That's
Confirmed.
that we know of that have been reported as of last week,
Wow.
Thursday. Yeah.
What do you know the population of dialysis patients in the state of New York? I mean, is that a low
Do
number? I mean, no death is acceptable, but is that considered a low
right.
number?
Well, we have a total dialysis population of about 28 to 29,000 in New York State. We have about that many patients in New York State. So out of all of those patients, 70 confirmed passing away from COVID. I would say that, I mean, like you said, no number is a good number, but I mean, it's just startling to hear, that many patients were infected and are no longer with us. I mean,
I
but
mean,
out of that 28,000 now, we still have almost 500 patients that have tested positive,
they just tested
confirmed.
positive, but that don't mean that they are like in the hospital and having issues, right?
Not all of those 491 are in the hospital. There are 250 of those patients in the hospital, so half of them are in the hospital.
Mm-hmm.
And I have a gentleman that I know right from Brooklyn, New York, that tested positive. He put it on Facebook, and he went in the hospital, I would say maybe about 2.5 weeks ago, and he just got released yesterday,
Mm-hmm.
so he
Mm-hmm.
made it out.
Let me ask you this.
Hmm.
I don't think a lot of people know, and some may, I don't know. But a lot of people don't know that hospitals are a breeding ground for infections. In fact, that's where you can get non-concomitant infection and from
Exactly.
hospital, because you have a lot of things going on in a hospital. Do you think, in your opinion, that when one gets hospitalized that may be compromised, that maybe being in a hospital could be an extra added risk?
That's
Uh,
the worst. That's the worst place for us to be. And that's why what they're doing here is they're trying to treat these patients and get them the devil out of there, and get them home. You're much better off getting treatment, and this goes for any chronic illness. You're much better off getting treated at home. Any type of
mm-hmm.
clinical environment is a breeding ground for infection, where there's a lot of people congregated in one particular space. And that
Right,
goes for
right.
dialysis centers, clinics, hospitals. That goes for anything.
Now, what's going on with the staffing? Has that
The
changed
staffing,
any?
no, the staffing issues, those numbers are increasing as well. They had, pardon me for looking at
Sure.
my paper, but they had over 250 staff members under observation, and over 150 staff members that were out with the virus.
So over 150 dialysis personnel. We don't know if it's
Correct.
techs, nurses, social
Right.
workers, dietitians, administrators, biomed. So we don't know if how many direct patient care staff has been
Right.
affected. Okay.
It's just reported as staff.
Okay. That could be people in administrative,
Right.
uh,
Right.
yes, support
Yeah. Any
staff.
discipline. Right.
Sure.
Right.
Now, are these covert 19 dialysis centers these centers that's been designated for
Mm-hmm.
patients who are positive to go to? How many are set up in the whole state of New York?
Well, for right now, from what I know of about five in the entire state. So they're moving these patients around as these centers are open. They had expedited. The state had to come in and give them expedited licenses so that they can get these centers open and up and running. Some of the hospital-based facilities, they had to get all of the non-COVID patients out of there and send them to satellite centers so they don't become COVID positive. So I'm telling you, there's been so much moving around up here for our
Now,
in-center patients.
is this temporarily or is this
Yeah.
permanent?
Well, I mean, it's temporary until this you know until this frenzy subsides. I would imagine, eventually, as these patients get better, they would be able to go back to a non. They would have to go back to a non-COVID unit, or they risk being maybe reinfected or what have you. As they get better, they'll go back to their facility of origin. But when
Now,
this pandemic is over, those facilities will be cleaned down, and they'll be opened up, as new dialysis facilities.
mhm. Now you're an ambassador with Rogenson Institute, correct?
Yes.
Now, how are they handling this pandemic? Their organization. Do you know?
Yeah. I mean, they're doing as well as as can be expected. They have 8 to 9 facilities within the Rogerson Institute. So what they're doing is just about what everybody else is doing. They're still struggling with their PPE. They're trying to keep everybody working and trying to keep everybody safe and healthy. But I would be safe to say they are having the same struggles as other facilities.
Mm-hmm. Mm-hmm. Now, have they designated any of their units as COVID-19 positive clinics?
No, from what I have understood is what they're doing is they're separating patients. They have one side COVID and one side non-COVID, or if they do have COVID patients, they're sending them to other facilities. So one of the things that has happened that's really interesting now is there's a lot of intermingling, or there's a lot of facilities talking. Like the independent facilities are they're playing nice now. Everybody's playing nice together because they have to swap patients now. So if Rogerson has an opening and there's a patient in one of the areas from a non-COVID, facility, everybody's taking each other's patients right now so that they can try to keep the patients from getting infected.
Mm-hmm.
So it's a lot of that going on right now. Everybody's being everybody's friend right now.
Wow. Um, so what about the supplies? That's still shortage?
We're still having now. We did receive from what I got Thursday. We received plenty of N95 masks, so those are being distributed and have been distributed to a lot of the facilities, but there's still a shortage on gowns as of Thursday. So we
Mm-hmm.
would hope over the weekend that some of that equipment has been deployed and sent to the dialysis units, because even though we are the compromised or the vulnerable population, dialysis centers were not first on the list when the federal batch of supplies came in.
Mm-hmm. Mm-hmm. Now, let's kind of shift gears for a minute. It has something to do with what's happening, far as getting out and getting access to fresh fruits, vegetables, and stuff like that. Now,
Yeah.
you have been tasked, or you had accepted to partner with the AAKP in their initiative, Are You Okay 5.1, and their National High Potassium Awareness Day, which is coming up May
Yeah.
1st. Now, how has being on a stay home order affected your intake or potassium? How is this tied in to what you're going through personally with this National High Potassium Awareness Day? Because some other warriors may be going through the same thing. Can you just share a little bit about this campaign and what it means to you?
Yeah. This is really important to me, and this is a great time for us to be talking about this topic and trying to spread awareness. I don't know if you noticed or if anybody else noticed, but a couple of months ago when I was on the show, I wasn't as big as I am now, but with all of this staying inside and having to prepare your own meals and not having the access to the types of food that I'm used to eating, I noticed that I'm putting on weight and I'm not able to eat the kinds of things that I'm really used to eating because I can't get out there and go to the supermarket with everyone else. In my neighborhood and uh, in my local area, they don't have those senior hours where I can go at 7 o'clock, just from 7 to 8 o'clock and go shopping. Everybody's waiting to go in at the same time. So I just don't go out food shopping at all. And now is the time where we have to kind of pick and choose what it is that we're going to eat. And some of the things are really not the best choices, but it's helping us to get by. And this is such an excellent time for this campaign so that we can be aware and to be more cautious of the food choices that we're making, because just like it's happening in New York, as this pandemic spreads and we have different hotspots across the country, there's going to be similar circumstances to what's taking place in New York. Maybe some of our warriors may not be able to get out and go to the supermarket and get fresh produce and to get the fresh meats and things like that, like they're used to getting. We can't even get food deliveries here in New York because all of the delivery spots are full. So this is the time where you really have to be careful. You got to be careful with your fluids, with your food intake, and all of these things, because you don't want to end up having to go to the hospital from fluid overload or high potassium or anything like that. So this is the perfect time for us to be aware of our potassium levels, and anything over 5.1 is damaging to your nerves, your heart, and your muscles.
Mm-hmm. Mm-hmm. Now, so in light of that, what do you have any tips, any small tips, being that you're in that situation, how you've been managing your potassium and keeping under 5.1 in addition to running long hours of treatment?
Well, like you said, I do that nice, slow, gentle dialysis, which really helps me keep my blood levels in order. But my doctor's on the preventative side, and believe it or not, he gave me a prescription for Veltassa. So if anything does jump off where my potassium gets, out of sorts or anything, I can have, a couple of doses of Veltassa just to keep everything level. But the main thing that I can say is a lot of people are relying on canned goods and foods that you can prepare quickly, and we just got to be so careful with the vegetables. Um, uh, those vegetables have to be rinsed off thoroughly before you prepare them. To get that added salt off. And you just have to try to, just try to eat the best that you possibly can. I know that I've eaten quite a few peanut butter sandwiches, since I've been locked in, because I haven't felt up to getting up cooking or something like that. But this is the time now where you have to be really careful. And again, in New York, they're cutting dialysis treatments to 3 hours in a
Are
lot of
there
the
any specific
facilities.
units doing that, or all the units? And
Yeah,
why
they're
are the
they're not
units
they're,
doing that?
they're not they're not all doing it, but some units are doing it because they have to add a fourth shift so that they can separate those COVID positive patients, because all of the COVID positive patients can't be moved to a COVID positive facility. So some of the facilities are
So,
trying to
so,
keep their own patients.
wait a minute. So you're telling me because they can't find a unit or for maybe people that may be COVID positive, someone else's treatment has to suffer. That's what you're saying?
That's the way that it's working here. And that's happening at quite a few facilities. Patients are getting 3 hours so that they can build that fourth shift.
But
so that they can dialyze.
isn't the purpose of treatment is to get as much dialysis as possible to get back to a quality life?
Absolutely, Steve. That's what I, I can't say it any more directly than I say it now. And I'm not saying this to put anybody down or to frighten anybody or anything. But my God, I'm just so thankful that I'm at home because I'm a big girl and you can't be cutting my treatment to 3 hours, you know?
And
I
let me
mean,
just
you're
say
only
this.
getting a little bit of treatment in the first place. Then you're going to take time away.
Now, would you contribute would you contribute 22 decades and 9 years on dialysis? Would you contribute that success in part to home dialysis?
I have to contribute most of I contribute it all to the God that I serve because I think that, this whole journey of mine is for the purpose of me being able to get out here and show other people, how great and wonderful God is. But I have to say without any doubt in my mind that I contribute a lot of my health and my longevity to doing my treatments at home. I have to because when I was in the dialysis center, I was in bad shape. I was sick and
Wow.
I was not going to make it many times. And the only time that I felt good, the only times that I have felt good and and that I've been able to have some type of quality to my life is when I've been at home.
Mm-hmm. That's awesome. Now, how many hours do you dialyze at home? For some people who may be wondering and watching this
I
show.
I, I dialyze every other day for 6 hours and 30 minutes at a
Six and a
nice
half
slow
hours.
6.5 hours every other day at a nice slow 300 blood flow.
Now, what would you say to some warriors who, when you just said 6.5 hours, they're like, what? Six and a
Yeah,
half hours? I can't do that. What would you say to those warriors?
I would say to them that was me, back in the beginning. I said, there's no way in the world. If I can't do 3.5 hours in the chair, there's no way that I'm going to be able to do 6.5 hours at home. But I have to tell you all, when I first started home dialysis, I was doing 3.5 hours, 5 days a week. And I started feeling better. And I felt so good until I asked to extend my time and to slow down my blood flow. I asked for more dialysis treatments. I was one of the first patients in New York to be a nocturnal home dialysis patient.
Wow.
I
You said one
asked
of the
for it.
first.
Yes,
So we're
I
talking to a
asked for it.
pioneer.
And my facility didn't have the policy and procedure for it. They told me that that they didn't have the policy and procedure for it, that I couldn't do nocturnal. And I told them if they didn't get it, I was calling the state. And by
Wow.
that afternoon, they got the policy and procedures together and they started me on training for nocturnal dialysis. And I haven't
Wow.
looked back since. You just don't feel the same. I don't know how to describe it, but there's no way to compare the feeling that you have when you get off the machine in the dialysis center than how you feel when you get off at home. I
I can
feel
imagine.
just like I did when I got on.
I can imagine in a unit when you're running 3 hours like a rigorous treatment trying to remove, say, four,
Oh,
5 liters at 3.5 hours. You got the blood flow rate running at 450, 500,
right.
and you know I mean, not you're not act. You mean you're not really being watched like you should be,
Yeah,
because the person who's taking care of you is taking care of, depending on the patient staff
yeah,
ratio. They may be looking at 3 patients or 4 patients, and you may be one of those three or
that's
one of
right.
those four. And so
Right.
uh, there's a lot of factors that go into doing dialysis in center. And on
Yeah,
top of that, you have, again, we talked about in the beginning as hospitals being a breeding ground for infection.
exactly.
Now,
Exactly.
dialysis centers are no different. When you got different patients coming through, you don't know who may have VRE or
Right.
MRSA because of the HIPAA. You may not know who got Hep B unless you see them inside the Hep B room.
Right.
So you just don't know who is HIV, hepatitis C. And so, with that being said, you have a multiple cesspool of viruses, bacteria, and germs inside a confined area where people touch doorknobs, they go into the bathroom, they come
That's
into the
right.
main door, they come into the treatment door, they up at the secretary's window. I mean, they're all over the
That's
place on the
right.
scale, touching the
Right.
handles, grabbing it. I mean, Don,
Yeah.
I mean, if I heard if I heard this program, and if I was on dialysis and just started, I'll be like, I need to change my treatment option and try home, because I'll be scared to death to hear all that bacteria and viruses that could potentially already be in a unit, but you don't know because of HIPAA, and maybe the
Right.
staff
Right.
don't know as well.
Yeah. And you remember I told you, on a couple of shows before, I got one of the worst infections of my life in the dialysis center. I got
What?
MRSA, and it took a month for me to get rid of that.
You wait a minute. You
I was
got a
unconscious
MRSA
for a
in the
month.
unit,
Yes, I did.
and is that the same time you said that you were unconscious for a month?
That's correct. That's
Wow.
correct. I had it so bad until they thought that I wasn't going to come back.
Well,
It it was
could you
it
just
was
share a little bit
horrible.
of how it got to that point?
Well, what happened was I was coming back from my kidney transplant, and my immune system was completely shut off because of the anti-rejection medications, and they had pumped me so full of steroids and anti-rejection medication trying to save the kidney. But I went into chronic rejection, lost the kidney, had to come back to dialysis, and I came back to dialysis with the catheter. I was receiving treatment at my dialysis center, which was a beautiful 5-star dialysis center. I mean, a beautiful facility. I still love those people to today. They took excellent care of me. But whether you love the people and whether they take excellent care of you or not, you can't tell what's floating around. You can't see MRSA, and I contracted MRSA in the dialysis unit, and I ended up in the hospital for months with that,
So how was it determined it was the dialysis center and not somewhere else?
because I hadn't been anywhere else. I
Mm-hmm.
was I was home in the bed because I had a fractured hip at the time, and
So it's not possible you could have
I
caught it from
had
your
had,
house?
well, nobody else in the house had it.
Mm.
I don't. I mean,
Right. No, I
I
was just
don't know how.
asking.
I don't know how that could. I don't know how that could take. If MRSA's like a bloodstream, kind of. I had a bloodstream infection. I had a catheter, and I wasn't messing with my catheter at that time. I was too sick to do anything.
Sure.
And so that the facility had to eat that one.
Mm-hmm. Wow.
Yeah.
Wow. So as we kind of close down this broadcast, what, I mean, 29-year kidney warrior. You had a transplant. You're in the hotbed, ground zero of COVID-19.
Yeah.
What would you tell warriors watching this show right now that may not even be in a hotbed for COVID-19, but maybe worrying, scared straight about what they see in New York, thinking it's coming their way? What can you share based on your experience and being safe, protected so far from this deadly disease? What words of encouragement or wisdom as a 29-year warrior can you share with them?
I would tell any warrior, don't be paranoid, don't worry, don't panic, but just protect yourself. Um, uh, Go to all of your dialysis treatments. Don't get afraid of the dialysis center and say I'm not going to treatment because I don't know who's sitting next to me, because that's the worst case scenario. Um, just practice your safe hygiene. We know how to do it. We've been taught how to wash our hands, wash our accesses, cover your face, cover up, uh, practice your social distancing, do all of the things that are instructed, the things that we've learned from the CDC, the things that that we're taught in our dialysis facility. Do all the things that you can to protect yourself. To those people of faith, stay prayed up. Um, don't watch the news all the time, because that makes you anxious and it makes you even more nervous about things. Turn that stuff off, limit your news watching, turn that stuff off, do things that make you happy, and just try to take as good a care of yourself as possible. But don't be paranoid to the point where you're not able to live and not able to enjoy your life. Watch your diet and just take good care of yourself.
Mm-hmm. Mm-hmm. Now, one last thing. When will you be able to come back and give us an update on what's going on with the task force?
Well, I'll have another meeting on Thursday where I'll get a new set of figures and I'll have all new information, and I'll try to find out some more information. I've been trying to find national information, but it's not posted as yet.
Mm-hmm.
So by the end of next week, I'll have some new information.
Okay. Okay. Now, do you have treatment tonight?
I sure do.
Oh, okay. Okay. That's great. That's great. All
Yeah, I
right,
sure
Don.
do. I think
Well,
I'm gonna take a kilo off. I'm feeling a little cheeky.
right. I hear you. I hear you. All right, Don. Well, thank you for sharing information, and especially with the ESRD Network 2 COVID-19 Task Force. We appreciate your hard work and what you do for the renal community.
Oh, thank you so much. And it was my pleasure. And I just wish everyone a happy Easter, a happy Passover. And everyone, please stay safe and take good care of yourselves.
All right. Don P. Edwards, home dialysis advocate, contributing education editor to Urban Health Outreach Media. Thanks again, Don. Stay safe and
All
God
right.
bless.
All right. Have a good night
All right,
now.
you too. Bye bye. All right. So as I about to end this show, again, I'd like to thank our partners, Kibo, makers of Renadil, which is a probiotic and prebiotic dietary supplement for kidney problems, low functioning kidney and renal deficiency. And again, FDA disclaimer, these statements have not been evaluated by the U.S. Food and Drug Administration. These products are not intended to diagnose, treat, cure, or to prevent any diseases. Also like to, and you can see, if you deal with any low kidney problems and you'd like to try this out, Kibo or Renadil has a special. We got the code. You go to their website at www.renadil.com. Register. You put in the code UKA 2020, and you can get 3 bottles for $141, which is this one right here, this ticker. Also, check out the AAKP National High Potassium Awareness Day coming up May 1st. They got a good campaign going on. Are you okay? All right. 0K. Are you okay? You get it? 0K. Are you okay.org. You can go to their site, give you tons of information, especially on their upcoming webinar, May the 1st. And one last partner I'd like to acknowledge is Dialysis Warrior Gear, maker of the mask. If you want a mask, reach out to him. Let me put his information. He's actually selling 2 for $12. And he ship them to you, I believe, free of charge. There go his information at Etsy.com. He has another style right there. You can get that at Dialysis Warrior Gear. Also, I'd like to congratulate and keep in thoughts and prayers and ask you to keep Daryl Queen in thoughts and prayers of Baltimore, Maryland. I personally know Daryl. He's a kidney warrior. He got the call today, right? He got the call to get his kidney at the University of Maryland Medical Center in the midst of a pandemic and on Easter Sunday. What a blessing. What a blessing. You can't get no other blessing of getting a transplant on Easter and in the midst of a pandemic where you hear a lot of information of they not doing transplants, this and that. But this gentleman is getting a transplant today as we speak. And also, I just like to, this is sad news, but like to give thoughts and prayers to the family of, wait a minute, let me just back up for 1 second. Just bear with me. I like to give thoughts and prayers, and I ask our listeners and all kidney warriors to give thoughts and prayers to the family of kidney warrior Gabriel Torres, who lost the battle yesterday. I just want to give a moment of silence for Gabriel Torres, who was on Sunday Morning Transplant Coffee Talk in August of 2019. I'd like to just give a moment of silence. Gabriel was a definite, never met the gentleman in my life other than over the internet. And let me tell you, with all he went through throughout his life and what he shared, this was a very, very positive individual. Very positive individual. I encourage you to watch this show. I posted it. I will repost it again with kidney warrior Gabriel Torres. You can learn a lot from this gentleman. You can learn a lot. Rest in peace, Gabriel. So, I'd like to thank you for watching another broadcast or special broadcast of World Kidney News. I am your host, Steve Belcher. Thank you for joining us. And as we end this broadcast, once again, I'll close out in memory of kidney warrior Gabriel Torres. God bless you and have a nice evening.